that we can get our values also.
Okay.
Thank you. So we are proceeding for the next case, and that is the a female 58-year-old. We are planning for Phaco with an implantation and topical. Here again it is a toric 2 and it's a cortical normal fundus. Diabetes under control. And here there is a positive finding. You see, the positive finding is endothelial count is less than 2000. Now you see, next. This should be taken care. This is the scan. Next. You see, here I am not saying this. Here you can see again here that I have not put the incision at 180 degree or 0 degree as regularly we are doing. To make the cylinder 0, that is you can see the ZCT225 is 0.02. To make it, what I have done is I put the incision at 135. See, as I told you earlier, we have to play with the placement of the incision, the size of the incision, and at the end, the cylinder should be less than 0.25 or so. So here the desired is only very less, 0.02. So this manipulation you can do it next. Next. So this is all normal. So this is the same picture which I was telling of the same patient we have taken. So you can see that on a left upper corner there is a blue line, ocean blue line. So there is a place of incision, and you can see the other side there is a axis which is marked. Next. So we can now mark 90 degree on both. Here you can notice that the, can you magnify this? Right click करें, magnify करो, zoom करो, you make the A करो, हाजी करो, yes. You can see now in a right eye, 1934 is the endothelial count.
Yes.
So here I have developed a software that whatever precautions we have to take, all the data are entered by the optometrist, and automatically there is a highlight of injection Oracor or injection Viscor. We have to use more in this particular case. So this is how we can prevent the complications and make the outcome very too much better. And on the right center side, you can see the size of incision 2.4. Can you make this right side? Here there are two lines, the red and the green. The red shows the steeper. It is automatically done by the software. The red is a steeper and green is a flatter. So usually I put the incision. If it is not toric, I always go for the steeper incision, and I can put the incision any axis. There is no bar about it. So I can put, and we can neutralize the pre-existing astigmatism in all the cases. Okay, thank you. So I'll just prepare the patient and we go for the next case. Thank you.
So I see that there is a rod which is there and your drape is over the rod. So I think this is for the patient comfort, that the drape is put over the rod so that the patient is able to breathe. As the patient is lying down, we can see.
Yeah. I understand. No, coach. Yeah, I asked him. You can focus here. You can focus this. This oxygen. Can you see the oxygen pipe which is coming?
Yes, sir. Yes, sir.
So same is coming. You can see up to this. You can focus here.
Yes, sir. Okay, this is going there.
Patient is getting the oxygen below the drape.
Okay, got it.
That's the reason of a slit, a still. And now here you can see, focus here. It is 135 degree. here. So my right hand will be here. So I'm going to put the incision exactly at 135, more or less. And second thing is, if the patient is not comfortable in a vertical incision or in an oblique, you can say the axis, then you can, sometimes I make the head little bit down. Can I make that down? Yes. So more eye is exposed. Now you can see I am comfortable, patient is also comfortable. Kamu બેન છે ને? Kamu બેન ઓળખ છો ને? ચિંતા ના કરતા, સરસ થઈ જશે. Don't worry. So you can see the roughly incision will be 135 here. You can make an exact marking if you want, but to save the time, I'm not going for that marking. And light માં જુઓ તો light off કરો. So this you can do even SE also. It's not a much problem. First thing I'm going to inject is Xylocard or Xylocaine preservative free. After that, the Viscoat or Orocoat, and in this case, I have used Hilon, and below Hilon, I'm injecting the methylcellulose hydro. The reason is that I'm more comfortable in Rexis when viscose is over the capsule. Okay, I think this is enough. Hilon. Air came out. Okay, so finish. Wash back. Up and down. Say so. So again, you can fix the eye with the left hand very gently with a very soft forceps.
Yes, I think we can see that very well.
Make 4 punctures, 1, 2, 3, 4 for a very junior running phase of a axis, and join all the 4 puncture, and then push it and create a flap. Light માં જોઈ રાખજો. If the pupil is regular, try to follow the Hilon is softer than viscoat. Okay, it's okay. Yes. So here it is 2.4 incision I am putting. At 135. Okay. Viscoat is there, next case. This axis. So this is a hydro. If you light my like if you feel like you can do hydro dissection also and hydro delineation. And as I told that between all the steps, I inject viscoelastic. You can rotate it. Sometimes I crack like this. So we can directly jump to the Phaco 2. I think, have you observed this? Hello? There is no connection. There is no connection. No, no one is responding. No one is there. Hello? Can you hear me? It's okay. But it is going alive. Okay, that's good. No problem. So you are seeing that I have cracked the nucleus by a specially designed chopper, and I just directly jump to the Phaco 2. This is a confirmative step that the two pieces I made are completely separated out. Dr. Rajesh, are you there? નથી આવતું. તમારા લિંકમાં જો હતો. You open the link and see. So we're reducing the vacuum. Visual order. So using more and more Helon because the endothelial count is less. So you saw that I cracked the online zone. How is it? Can you hear the sound? Checked? Okay, good. Because panelists are not there. Okay, so you can see that I've reduced the Phaco power by making the two halves of nucleus by specially designed chopper. Use very low vacuum for engaging the epinucleus. No, is it center? Centering. So as I told you that we inject the disco before removing the Phaco probe. If you like, you can supplement and make the chamber deep. Posture capsule track. I am. Is it live? Can you call to sir? Okay. They are not there. Call to Dr. Namrata. So very simple step, as you know, the catch, pull and aspirate. Catch, pull and aspirate. This is the way. And then we go for the fine polishing of a posture capsule. I think you can appreciate now. I like to inject in Visualon, under Visualon. Stop. Irrigation is stopped now. Injecting the visco. Keep the chamber filled all the time. More or less all the steps of IOL. Okay. So again you can see this is ZCT225 25 diopter, and This time I'll put a little bit, a drop of viscoelastic over the lens so that it does not stuck.
Drops.
So chances of entanglement of, you can say, the stacking of loops are less. Okay. Go to Sami. Okay. Sit. Yes. It is 2.4 incision, technohistoric, 25.5 data with thicker lens, and cylinder is 225. Before this gets opened up, inject some Visilon, taking care that you don't touch the endothelium, and push it in the bag. Yeah. First I said separate I remove the, I make the marking after once I am confirmed that yes, now it is open. Is that? So why? Huh? Okay, okay. Visible. So Delhi માં નથી ને? Okay, good. So here again the temper bone, as our application says, is કેટલું છે temper bone? This is a left eye છે ને? હા left eye છે.
Right eye sir. Only 80 degree.
Right eye છે એટલે 2 આવશે. Yes. So this is 2 degree and eye position क्या છે?
180.
So I am keeping this at 2. So hardly there is some marking needed because so this is 1, this is 178 means 2 only. So not much marking required because the original marking is more or less same as what we want. So just press the posterior lip, give a only irrigation because the binding of hilon and endothelium is so strong, you should not aspirate, you should not use the suction. Otherwise, it can take away the endothelium also. So making this removal of this visco behind the IOL. And keeping this axis, again all the 3 Purkinje's images should be neutralized, make it one line, and you can see it's exactly at 180. Light માં જુઓ તો હા બહુ સરસ થઈ ગયું. So making this hide through completely. Okay, good. Now what I do is I release the speculum and lift it little bit up and what I do? To show it, I'm trying to remove the bubbles in the anterior chamber. Now, there are very common thing and question there, why it rotates, because there is a fluid behind the, so I'm pressing little bit, you can see, pressing little bit, so that the fluid behind the IOL is more or less milked out. And this will be done with the keeping the spectrum loose and up. And this is how I inject the viscoelastic. Sorry, moxie with BSS.
Right.
So this